This show, we are going to be reintroducing our women's health specialist, Aiyana Davison, out of Southern California. In part one, we discussed gynecological health, birthing, midwifery, and the pregnancy. And this time in part two, we're going to move further on towards the ending of the pregnancy, briefly touching on postpartum experience. And then we're going to be moving into women's health on a more general term. So, without further ado, I'd like to introduce once again Aiyana Davison, a certified nursing midwife, women's health nurse practitioner. Please join me in welcoming her back in. Hello, darling. How are you?
Hi, I'm well. How are
Did I
you?
get all the titling right this time? I usually mess
Certified
it
nurse
up.
midwife, women's health NP, nurse practitioner. Yes, you got it.
Okay, cool, cool. It's so nice to have you back. It's always a joy to have you here and have you home in some way or fashion. But we had a great time the last show, and we had a lot of calls, a lot of hits, a lot of women responding, a lot of questions that they asked, and they've been writing in. So you did make a difference, and that's what we're here for. Um, Today we're going to push forward into a bigger experience on the women's health venue. So I'd like to speak to perimenopausal, that horrible word that we hear, which is not really as horrible if we talk about it.
Mhm.
And that's what we've been talking about, getting the experience, getting women to talk about the experience and moving away from this secrecy and this strange silence of, oh, we don't talk about that. Women need to talk about it because there are depressions, there are mood swings, there are things that affect us that we need to have a voice, if only with each other. We need to have a voice so we can get through this together and
Mhm.
realize it's not that bad. So, having said that, I would love to speak with you about menopause. I'd love to speak with you about the importance of having your exams, because it's not just, we don't just go to the doctors when we're pregnant and, we were delivering. We need to continue those relationships with our OBGYNs and our healthcare practitioners and continued health, because a lot of women don't realize, Aiyana,
Mhm.
that as our organs get older,
Mhm.
they need a lot more maintenance. So we need to take care. And on that note, I'm going to sit back and let you do what you do. So, ladies and gentlemen, Aiyana Davison once again.
Yeah. So, I mean, perimenopause, um, it can be a scary time, but it doesn't have to be. We can kind of guide you through that process as well, just as like we would guide you through a pregnancy. If you're coming to see us, it's important to still get that care as well. So menopause, perimenopause, let's start with that. Peri means around or surrounding. So it's around the time of menopause. So you haven't quite hit menopause, but you're coming up to it. So menopause is defined as the absence of a period or menstruation for a full year, so 12 months, um, and you haven't had a period. So if you are skipping periods and you've gone 6 months and you haven't had a period and then all of a sudden it shows up, I'm sorry to tell you, you're still in perimenopause. You haven't transitioned quite to menopause, but it's coming. It's coming. And I think the other important factor to remember as well is you can go through an early menopause due to medication, certain disease processes, as well as like a hysterectomy or full removal of your uterus and ovaries. And so it's important to know that you can experience those same symptoms early on or at a different time, depending on the history. I think it's important to know, and I try to ask this question when I'm talking to clients or patients in the office. when did your family go through menopause? That's super important, or it is a factor. And just like you talked about the secrecy, we have some people who just don't know because they don't talk about it with their family members, or it comes up only after they've experienced something, and then their family member is like, "Well, I had that too," And so it's really important to begin to break down that kind of shield that we put up, and know that it's safe to talk about these things. We have so much power, like especially those of us who have uteruses and vaginas, or uteri and vaginas. We have so
Why
much
did you bring
power.
that quiet? Why did you say that so quietly?
I don't know. It just
Uterus and vagina.
We have so
But you know
much
what?
power. Mm-hmm.
We do have a lot of power. And it's so funny. I want to backtrack on something that you just mentioned with
Mm-hmm.
regard to the family dynamic. And it's so funny because as you said that, I got this flash. Usually we know, but we don't know that we know that we know, because the craziness that women, especially back in the 50s and 60s when I was growing up, women were acting kind of crazy at a certain age. And then when you figured out what it was, it made so much sense as to why mom and auntie and godmother was going off the rails like that. And they had a drink in their hand. And I mean, certain things made sense because they were just trying to cope, baby.
Mm-hmm.
And they didn't have the information that we had either. The information that we have now at our fingertips, they didn't have. The only reason that we got through is my mom was a doctor.
Yeah.
And my family's was in the nursing field, so they kind of, but it was still hush hush. But back to the power of the pussy. Go ahead.
That's precisely it, the power of pussy. And I wish more folks would lean into it. And I can't fault people, because you have to recognize your own comfort level with certain things. But also, if we were to recognize and become more comfortable with the power that we do have, we would really be taking over the world, which we're trying to. We really are. For so long, it's been like the patriarchy telling us about our body, what we can do, what we can't do, how many babies we can have, how many babies we shouldn't have, that kind of thing. And so it's really time to just take that back, because it's our bodies, it belongs to us. So
I'm sorry, I can't miss the opportunity of what you just said 5 minutes ago in terms of taking the power and having the power. By the way, we have a woman in the White House. There are laws on the books that
as the
affect us
vice president.
that men were manipulating our bodies. So power to the Harris of the people. Go ahead.
And hold her accountable.
That's
That's
it.
that's the thing. Like, we got you here, so now what will you do with that said power that you do have? And it's important to recognize that. So we break down walls at every turn, but what's important for us is to make sure we have the knowledge going forward. So
Exactly.
in menopause, circling back to what we were talking about, but in menopause, there's quite a number of things that can happen. And I think most people are familiar with like hot flashes, night sweats, mood changes. And who knows, like in the 50s and 60s, it could be the menopause, but could also be like the times that they were living in as well. But like you said, we do have so many more resources available. And in addition, there's other things that folks experience too. Changes in libido. Some people, menopause typically can decrease it, but there are some people, when they're going through menopause and they've gone through it and they've been in it for a while, may realize, oh, wait a second, like my drive has gone up now. But then at the same time, they're experiencing vaginal dryness. And those are things that we can actually help with. It's important too that it's specific and individualized, even though this is something that happens to many folks. And what I mean by that is, if you have something else going on, if you have hypertension or diabetes, I may not be able to give you like an herbal remedy that I would just give to somebody who doesn't have those things, or certain medications. If you've had a history of cancer, like there's certain things that we might avoid in treatment, but maybe something else that we can use. So it's really important for you to have the discussion with like your provider to find out what can work for you. Also, that these symptoms don't necessarily last forever, but they can last a long period of time. And so that's the frustrating part, because if you're going through a year or 2 or 3 of certain things like hot flashes, it's not just like, oh, I'm hot. It is like you are burning up and on fire. And like, and we say layer clothes, like that's one thing. But like when you're burning up, when I'm hot and I'm not menopausal, I want to strip down. And I can only imagine someone who's going through a hot flash or a hot flush where you're like dripping wet. This is not just your body's actually experiencing something. You're not going crazy. Like, again, I think a lot of in a different time, people were saying, oh, you're fine, you're just going through whatever. No, this is a real thing, and like we need to do something to kind of help this person along the way. So menopause is, I don't want it to be a scary time for folks. I want it to be a time where they're like understanding like things are shifting. So, people, maybe the understanding is like, oh, estrogen is no longer there. It's not that estrogen isn't there. It's that it's a different type of estrogen. We're using a different, there's, 3 main estrogen components that we have, and you're just not using the one that you used for so long. So, or that's not the primary source of estrogen. So things change. It can be treatable in certain cases, and you will get through this time. You will be able to manage, but talk to your practitioner about that.
I think my estrogen likes cheesecake a lot.
Yeah. How we metabolize changes, because all of that's interconnected. Like, your cycle as it comes to periods is tied into your metabolism and other hormones. Like, this is all a circle. Like, it's just a feedback loop of hormones. And so, whereas you could eat the cheesecake in our 20s and be fine, you eat the cheesecake now, you're gonna see it on your right hip tomorrow. Like, so things to consider.
So, question. It's not about age anymore. Back then it was, oh, I'm going 30, 40, 50, 55. You're definitely in menopause. It is more so, it could be a hysterectomy, it could be genetics, it could be family history. Mm-hmm. There's a whole bunch of other components that are involved. That's correct?
It's a whole bunch of components, but full-blown menopause is no period for 12 months. And this isn't just like it happened once, like, because there are some people who will go through what we call secondary amenorrhea, which is the absence of a period. And like, let's say they're 25, but that usually there's something going on there. So to make sure it's not early menopause, you do want to talk to somebody about it. But yeah, a full year of no periods, usually around the age 45, 47 and upwards, where some people will go through that. Some people as late as 55, 60. Again, if you are having a period and it stops for a couple of months but it comes back, you're in perimenopause.
Hey y'all, I am checking in today with you to see where your heart is at. Where's your energy? How are you feeling? Have you taken a moment to take some breaths? Have you taken a moment to walk away, to turn off social media? Maybe you're not even here and you're seeing this later. I hope you are, and taking the time out for you. I want to remind you to protect yourself, protect your mental well-being, protect your physical well-being, to turn off your phone if you need to be with family and loved ones if you need to sit in a tub, to sage, to write, to reflect, to eat something good and hearty and healthy. Whatever you need to make it through, I want you to do that today.
question I can read. This is from RH. I've been told in menopause
Mhm.
that I can get pregnant with twins. Is that true?
So if you're in full-blown menopause, that's not possible. Like you've had no period for a year. In perimenopause, you can get pregnant because, let me backtrack. In perimenopause, you might be able to get pregnant because you're still having periods, and that means you're most likely still ovulating. So there is that possibility. I have seen pregnancies in the 40 age range that were surprises or unexpected because they thought that they were in menopause but just happened to like miss a couple of periods, and then all of a sudden their period came back and then all of a sudden went away, and they still thought that they were experiencing perimenopause, but it was actually a pregnancy. So that's possible. But during menopause, you are not releasing an egg and you're not ovulating. So there is no possibility of you getting pregnant. I mean, strange things have happened, but not usually during menopause.
Okay. And this question, I want to know the answer to this question.
Uh-oh.
If I have passed through menopause already and my uterus is intact,
Mhm.
can I carry a child for someone in vitro fertilized? That's interesting.
That is a really great question. So I believe I've seen this happen before. I would actually have to look into that because if you think about what is required for pregnancy, it requires the uterine lining to be built up to a way that's stable enough to implant and sustain a fetus. Now, if they're just, I would say on the side of no, but I honestly would have to, that's a little bit beyond what I usually get into. To carry a baby for someone else, I don't know that it would be able to be implanted if the uterine lining is not at the levels that it's required to be. However, we also have a lot of skill with hormonal like balance. And
Mhm.
so perhaps they can do some kind of hormone replacement to get that. That's something that I would.
All right. Well, LD, that's who this question came from.
Uh,
We're gonna have to get back to you with further information. But that was a pretty good answer, so I'd stick with that. Um, Speak to your healthcare professional.
mhm.
I get the impression that she didn't want to talk to her healthcare professional about that, so that's why she sent the question into us to test the water. But it's everything is possible.
Yeah.
So, all right. So let's move on. Um, I would like, and we're dealing with menopause and so on, but I would like to lean more on the exams that we need as we grow older.
Mhm.
I know the pap smear should be done at least every year, 6 months to a year or a year.
So that's actually not true.
Okay, see, this
Um,
is how we have the conversation.
so in a person with we based off of guidelines, and again, this has to be individualized as well. So and I'll go into why some people will get PAPs annually. There is a fiscal reason for it. However, based on our guidelines, to avoid the increase in false positives of a pap smear, um, people under the age of 30 should be screened every 3 years, and over the age of 30, every 3 to 5. So, and we start pap smears at age 21, not age 18, as they did in the past. So, like when I first got my first pap smear, I was 18. And I begged my mom to go get one. I'm just strained. I don't know why I did this to myself, but I was like, it's time. I've got to take care of my health. I wanted to be like at the forefront of like my healthcare at that time. And I said, Mom, let's go. And she's like, all right, okay. And then she asked me if I wanted her to come in with me. And I was like, no, I'm going to do this on my own. I don't know what I was thinking. But also, I really do, again, in the platform that I do have, I really want folks to feel more comfortable with their pap smears as well. It's you get to a say in how it goes. You know, I have folks who ask for a mirror when we're doing the pap smear, and that's completely fine. Like, you should be able to see your cervix, and I should be able to show it to you. And no one should be shoving a speculum in your vagina. Like, this is something that can be paced, and it can be controlled, and it can be timed, and you get to say so. But anyways, so we're going back to menopause. If you've had regular periods, regular pap smears, no major like gynecological conditions, every 3 to 5 years is a screening time frame that we do for pap smears. And in a pap smear, we're looking at the cellular level of your cervix and the cervix cells that are surrounding there. So we're also screening for HPV, which is human papillomavirus, which we know now can be a precursor to cancer cells. And so we screen for high-risk types of HPV that can lead to cancer, as well as looking at the cytology or the cell structure and the cellular makeup of your cervix. So depending on, like, if the history's been fine, then you could go 5 years without having a pap. And I know that sounds crazy to some people. And for people who have had history of like cervical cancer, etc., this might sound wild. Number one, you get to ask for what you want. So if you want an annual screening, you can definitely have one. Just know that it can increase your risk of a false positive, meaning like something will show up. And that can also mean we move to more aggressive screening, which if you are going back to childbearing age, if you're of the childbearing age, sometimes the procedures that we do can compromise how you carry a baby in the long run. Not going to get into too much detail about that, but you know, again, and then if that comes back negative, you've just done a procedure that perhaps you didn't need to do. And so I don't know if that's making some sense there. And then I just lost my train of thought, but
nope, you're on it.
But you can ask for a pap smear if you're feeling uncomfortable. Now, if you're in menopause, you've had bleeding, but you've had a normal pap, like let's say you had a spontaneous episode of bleeding, and no abnormal pap smears, it might be something that your practitioner recommends you getting, just to, you know, rule out cancer and make sure that that's not present. So that is something that you could request, or they might do in terms of your screening. You were asking about what to look out at each, you know, as you progress in life, what are the screenings that we should be doing? Again, the pap smear is indicated. Thyroid levels, diabetic levels. It really depends on your age, and you might find that your family practitioner will run some tests before they send you to like a specialist, like in OB, obstetrics, or gynecological care. And so it just depends on your history. So, you know, in the absence of anything like significant, any diagnoses or history, usually we're, you know, doing your pap every 3 to 5 years, making sure everything is good.
Okay.
It's a lot. It really is.
But, and then this is why we do this, because we want people to tap in and tap into themselves. That's really what this is about. We are here speaking with Aiyana Davison, women's health care nursing practitioner. I got it right this time. And it's also National Nursing Practitioners Week. week. This
Nurse,
week.
nurse practitioner week. Yes.
Yes. Yay. I should have bought some balloons. But we're going to take a quick break with ESP Speaks. And we're going to come back in a moment and continue our conversation with Aiyana Davison. Come on back, everybody.
Zoe,
What?
you saw her, right?
Yeah, I saw
know
a
you
stinking
did.
heifer.
I know. What happened?
So we
What
go
happened?
to Joanne's, right?
Let me
And
tell it. It's always something. Anyway, Zoe and I go to the craft store, right? So we get online. I got my phone. She has her phone. We have the app for the coupons. Zoe's girl is like, yo, I'm gonna put every coupon on here that I can. And my girl is like, you can only apply one coupon for the whole purchase.
Oh, Lord.
One of
I
those
can
that thinks she runs the joint.
I can only
Wrong.
imagine what you did after that.
Okay, this is what I did.
What'd you do?
I told her, I said, no, thank you. I don't want it. I grabbed my stuff.
Rhonda.
And I went straight over to Zoe's cash.
She
That's
did.
just like you
Yep.
because you cheap.
She is cheap.
Yes,
She's
really? Oh, really? I'm so cheap, but I took you there and paid for the gas.
Oh,
right?
wait a minute. It is like 3 blocks away. Your lazy behind didn't want to walk.
That's so
true,
I'm not
though.
going with you no
It is.
more.
Oh, my
I'm not going
gosh.
to that
That's
location
okay.
or with you.
I can walk.
You got the
And we're back with ESPSpeaks. We're also talking to Aiyana Davison, certified nurse health practitioner. I'm sure I got that wrong, but she's going to correct me. And we've been talking about after the baby's born, the hospital experience. You haven't gone home yet. You haven't even gotten off the operating table. There's an element of this whole procedure that we have not been talking about in our societies, and that is the placenta. Until now, unless you've been giving birth at home or you've been given birth with a midwife, excuse me, we haven't really been talking about the idea of the amniotic sac. I'm going to step back and I'm going to let the professional take this one. Aiyana, let's deal with the placenta.
Of course. Yes. Placenta is absolutely a powerhouse. It is what provides nutrients, oxygen. It is the life or the lifeline between baby and the parent. And it's super important that we make sure that that's functioning well during a pregnancy. And that is something that comes out after a baby is born. And I think we do oftentimes kind of dismiss that and don't talk about that. There's different things that can happen, with the placenta after someone delivers. And I think we talked about that the last time we talked about like hemorrhage and stuff like that too. But all that to say, the placenta, while it hasn't been well studied in terms of its use after pregnancy, and when I say use, there are people who will ingest it in different forms, but some people attribute their mood to, I know we can talk about it too, so some people will attribute their a better mood because they've had, like, perhaps their placenta's been encapsulated or put in a pill form and then they take that, but when a baby's born, we focus on, these days, many practitioners will focus on what's called delayed cord clamping, which is clamping the umbilical cord. It's just like it sounds, so that the baby can get the extra reserve and blood flow through. There's really no reason to disconnect or cut the cord. Even with resuscitation or trying to help a baby, there's no real reason to do that in most cases. And so baby's born. When it's time, the cord is cut in some shape or fashion, and then the placenta comes out, and folks don't usually follow the life of a placenta. They don't know where it goes after. And so some people will take it home. Some hospitals have policies where you have to sign your placenta out or waive that you want to take it home, if you will. And some places allow you to just take it, which it's yours, so you should be able to take it. But the part that is important is, for some folks, it's for ritual. They'll take it home, they'll plant it somewhere. You'll notice that, like, wherever you plant it, it's going to grow. Whatever's there is going to grow and grow wild, you know, because again, it is this powerhouse that we talked about. And again, like I said, some people will, I don't want to be too vulgar for folks listening, but some people will find ways to put it into a meal, again, because of the nutrients and the properties that it does have. It's argued that perhaps there's not much value to it, but if it makes someone feel better and they think that things have improved because of it, I am all for it. So
I'm still trying to get past the fact that there's baby poop and stuff in it, but okay.
And not always. So sometimes that happens, they'll have meconium, but you have to remember too, meconium is sterile. So it's not like, you know, the baby's been in there eating hamburgers. Despite the parent eating hamburgers, the baby hasn't been in there eating that. And so it's not the same level of toxin that we're thinking about when you are now outside of the womb.
Definitely.
So now, I will say, if there's an infection that does happen in labor, you might want to reconsider ingesting it. Or if there's like a complication in pregnancy, sometimes your provider might recommend, like, I would like to send your placenta to a pathologist so that they can look at the cells and see what's happening, and look at the placenta to see if there's something that might have contributed to problems.
And that is the key. That's where I'm going with this whole conversation, because what women do not know is the testing value, the resource of information that it is. And this is why you should ask for it, not only because it's yours, but once again, we're guinea pigs without our consent.
Right.
It's a part of you. You are legally allowed to take it with you. You have a voice in this. So bring the cooler and take it with you, because placenta, for those of you who buy $200 and $300 face creams, is in face creams. It's in the cosmetic industry. It's in the suntan industry. And if you have melanin in your skin, these fluids are definitely being used in products. So your thought is, this thing is being destroyed, the afterbirth is being burned, and that's what some hospitals will let you believe. But they are actually selling this to cosmetic firms in some cases. So once again, it's yours. Take it home, plant a tree in your backyard. My mother planted 7 trees, and they're all still thriving, one of which is over 60 years old. So there is power behind that. Anyway, on that note, I'm going to bring you back. In fact, we should take a break. We should take a commercial break, and then we'll come back with Aiyana Davison, and we'll answer a couple of questions. We'll see you soon. Hang with us on ESPSpeaks.
Happy birthday to you. Happy birthday. Make a wish. I know she ain't about.
Ew.
Oh my goodness.
Please don't do that. Oh, no, she ain't.
That's not right.
No bueno.
No cake for me.
Yikes.
Fanta cake is the cool new sanitary way to blow out the candles on your cake.
Make a wish.
I love my Fanta cake.
Fanta cake rock. I want some cake.
That's cool.
Get yours today at fantacake.com.
There you go. And we're back. with ESPSpeaks. We are here with Aiyana Davison. She is a certified nurse midwife and women's health nurse practitioner. And we have, I got it right.
Yes.
And we've been chatting about women's health, and we're going to tie it up with some very strong points, because this is something I really need to hear from you, Aiyana. Please tell the audience, please tell the family of women what they really need to get up and do to protect themselves, because there are a lot of older women, some of them my age and plus, who are really not doing the examinations that they should be. But women of every age, these are the examinations that you should have on a regular basis. Please tell them about that, because I want them to have that information before we leave.
Not every age, but when we get to certain time frames, there are some routine screenings that should happen. So I'm not going to tell a 20-year-old.
When I said every age, I meant every woman. So give them to them by age. So in your 20s, you're supposed to have this. In your 30s, you're supposed to have this. In your 40s, you're supposed to have this. In your 50s, you're supposed to have this. And go.
So, okay. So again, that's a little tricky too, because depending on family history and personal history will determine, if we need to do things sooner. But the things you want to look at, especially postmenopausal is and even perimenopause or a little bit earlier, depending on when menopause starts for you, you want to get your mammogram, and different practitioners will suggest different starting ages for that because of guidelines that are given to us. If you have American Cancer Society, but you also might have another organization saying something different. But mammograms can begin as early as 40, sometimes even earlier than that if there's a family history, or if you find something and there's a reason to get a mammogram done. And some will suggest annually, some suggest every 2 years if it's been clear, no immediately family history. You want to also consider your colonoscopy. That's important to get done. And that's in your 50s, and I believe it's every 10 years, depending again on the guidelines that are recommended and the findings that are there and family history. And then also your pap smear, like I mentioned before, every 3 to 5 years. Give again specific to everyone on an individual basis, depending on their history, also, other family history as well. So those are the main screenings. You might have your practitioner might also recommend getting diabetic screening, because with age increases the risk of diabetes as well. And then cardiovascular screening, again, dependent on your history, etc.
Wow. That's a lot. That's a lot. That's a lot. But we do thank you. We're blessed to have you here. We're blessed to have all of this information. And before we go into final remarks from you, because I'm sure that you have one tie-up thought that you want to give all the ladies, I want to talk to them about the continued series that we are having. So we've been in women's health. We're starting out with women's health, because I start with you guys because you are the strong backbone. So we have to make sure that you're healthy first. But next week on the show, we're going to be moving into the psychological and the mental side of things, especially during COVID. We all need a little extra help. We all have been going through some sort of depression, some sort of change. So I have invited Dr. Shay Johnson, who is one of Psychology Today's top picks. He also happens to be my fraternity brother. He's going to be on the show for a 2-part intervention of what's on your mind and how can we help. So you're going to be able to write in questions just like you did for Aiyana, and we're going to deal with what's bugging you. So please join us. That's going to be, I forget which Friday that is. What's this Friday? Is this the 16th, 17th? It's going to be the Friday after that. But anyway, we're going to have him on. I'll put up the dates. And I want to come back to Aiyana, because I want you to give us your information for how can they contact you, how can they write you, how can they Instagram you. I'm going to put it all up anyway, you know that. But I love when you get a chance to connect with them and tell them for yourself. So can you give us that information, please?
Absolutely, absolutely. So currently you can find me on my website, which is www.thevaginachronicles.org. And that is a place that I am building up and creating safe space for people and community and a chance to connect as well as be informed, purchase products. Those are coming soon. And then you can also find me on Instagram at The Vagina Chronicles and Twitter. I'm not on there very often, but I am there occasionally, and I'm The Vag Chronicles or Chronicle because Instagram won't let me have the full name there. So
We'll let you have the whole vagina.
right. And I also am working on developing a Facebook community as well. So stay tuned for that. I will let you all know when that is available.
Awesome. And of course, you'll be back on with us again. So we look forward to that as well. And as always, it's a pleasure and it's always a joy for you to sit with us and give us all of this amazing information. So we will see you next time on ESP Speaks. And until then, you know what I'm going to say. Be positive, test negative. Have a great day.